You're watching the Fox-11 News at noon.
And welcome back to the Fox-11 News at noon. Thanks for sticking with us. I'm Bob DeCastro.
And I'm Marla Tejas. Developing news just in, LAUSD has unanimously approved an agreement with UTLA for a return to in-person instruction next month.
So the deal still needs to be ratified by the UTLA members, and that is expected to happen next week. All right, on to this story. Some are calling them Generation C, and there are growing concerns about the impact the pandemic will have down the road for the youngest among our population.
From being pulled from school to losing out on social interaction altogether, our youngest generation is being shaped by this pandemic, effects that may last for years. To further discuss this topic, we welcome to the Fox-11 News at noon pediatric psychiatrist Dr. Mitali Wadekar. I hope I got your name right. How did I do?
Yes, you did.
Okay, very good. Doctor, thank you so much. So Generation C, this youngest generation dealing with online learning, being stuck at home. We know the effects this has turned into a mental health crisis. What are you seeing within your office?
Yes, that is an excellent, point. The pandemic has had a tremendous mental health impact on these younger population, these children, adolescent. The social isolation has taken a big toll. We are seeing increased anxiety, increased, rates of depression in these children. It's very uncertain. These times have been very uncertain for them. The parental stress sort of also gets displaced upon these children, not knowing what's going to happen with their school, not getting to see their friends, not getting to go to their music class, their sports events. It's just adding up.
And so how does that anxiety and depression, Dr. Wadekar, manifest itself? What are you seeing there among kids, and what should parents be looking out for?
That's a great question. With the younger children, it may not be as clear. They may show their anxiety or depression in various forms. Anger, not able to follow.
Oh, that's one of the pitfalls.
Right.
Zoom is so great, and then sometimes this happens. So maybe we can see if we can get Dr. Wadekar back online while we do that. We will move on in the meantime, but yes, and we were talking about how it impacts younger kids in a different way versus older kids. I interviewed a mom, and you have similar stories, where her first grader is adapting just fine because she doesn't necessarily know.
I know some parents that have one child and the child's young, barely in school, so that didn't really interact with a lot of children. But now older kids, obviously they're so used to all the interaction, going to school and missing their family and missing all of their friends.
And I do think, Dr. Wadekar, you're back with us. Very good. So Bob and I were just talking about how the impacts are felt differently for different age groups. Can you enlighten us with more on that?
Correct. I was saying before I froze that, the younger children may show their anxiety and depression in other forms, like anger, refusal to comply with their daily routines, sleep disturbances, low energy, just shutting down, withdrawing, not wanting to eat, not wanting to talk much, not wanting to be on their online classes, those type of things. And with older children, it may be a little bit more, they may be a little bit more verbal about their feelings, not wanting to interact with anybody, just low energy, low appetite, wanting to sleep all day or not being able to sleep at night, so these are the different ways children can show anxiety, and parents have to keep an eye on that, notice and keep open lines of communication, when they want to talk, be honest about what's going on, what the situation is, time has come back to go to school, and trying to normalize their routine as much as possible will be important.
The difficulty is in many of these cases because they're at home, almost stuck at home, if you will, with their parents, that they don't want to talk to their parents. They'd rather talk to their own peers. I mean, that must be an added difficulty. So what, as a takeaway, doctor, could parents really do if really their child is experiencing any of these forms of depression, anxiety? What should they be doing?
You're absolutely right. Sometimes children, especially older teenagers, adolescents, they may not feel comfortable talking directly with their parents, but having them chat regularly with peers their age, their friends, their cousins, having letting them know that there are therapists, mental health professionals waiting to talk to them if they need that help. Just keeping open doors of communication, being honest about what's going on, and leaving an open door. Whenever they are ready, you let them know that you're here for them and you're here to talk to them. And believe it, it's very important. Believe it or not, children are very resilient, so they will adjust. They just need that support behind them. So as parents, as caregivers, we have to be that strong support, and a sounding board to hear what they have to say.
Dr. Mitali Wadekar, thank you so much. Thanks for sticking with us throughout the little
You're welcome. Thank you.
Zoom road bump there. Okay, thanks.
No shame in getting help, right?
No,
That's
absolutely
always
not.
the
Speak
important
up.
message, right?
Yep.
Speak up and help each other out there.